Oh, good morning, buenos dias. Well, good afternoon now. All right, well, let's begin. I'll introduce myself again. Question, just for the sake of brevity. We should do this in English, yes? For everybody to understand, correct? English is the best language to do this in? Yes, okay. Just question. Okay, my name is Simon Santo Domingo. Welcome, welcome. Hi, Claudia, how are you? We are CARECEN, the Central American Resource Center. We have a nice presentation for you today. We're going to talk about our project, the progress that we made, challenges, and all sorts of fun stuff that I think hopefully you'll find interesting. But first, I would like to talk a little bit about who we are, just so you know, it doesn't come out of nowhere. Central American Resource Center was founded in 1981. We are a community-based organization that focuses on helping the Hispanic community in DC. And in general, we're trying to expand to the DMV, but our work with the health literacy program has centered around DC. This all began because of the pandemic and the need that we saw alongside BC Health to be a service that could be there for our community, because there is so many sources in English that have no translation to Spanish. Many people here coming, especially undocumented, many people who don't know English don't have access to those resources. So we wanted to be that bridge, that safe space for Spanish-speaking Latin Americans and Americans to find the resources that they need. Okay. First of all, CARECEN was founded in 1981 out of the detritus of the Central American Wars, and was here to provide support to Latin Americans escaping violence. I'm one of those. 10 years ago, I left Venezuela, escaping the situation there. And in CARECEN, I found a wonderful people that has been a great help to everybody that they touch. So we're here to make DC a better place for immigrants. So, like I said before, DC Health and CARECEN has the work that we've done has centered around community engagement. We provide health literacy workshops, we attend events, we educate our community to make better health decisions. But without further ado, I would like to introduce my partner, Jonathan Nolasco, who's going to talk to you guys a little bit about our focus points, about our work that we've done, and just in general, he will run you everything that we've done. Thank you very much.
All right. Our focus points for today are going to be outreach and education, being a source to our community. We'll also talk about expanding awareness. We'll also share feedback from participants and adaptation and growth. Outreach and education has been an important part of our job, because through outreach and education, we've been able to empower our community members to make more informed decisions about their health. We also participate in many events, such as community fairs, cultural events, school events that have hosted between 200 to 900 attendees. And during these events, we've been able to provide materials related to health in a language that is culturally appropriate for the participants. And we have done that with the help of La Señora Maria right here and Alicia, our promotoras de salud. We also created a series of workshops and curriculums that there was a total of 6 workshops that we created. These workshops simplified the understanding of different health-related topics that were commonly discussed in our community. Also, with the help of this amazing tool that we all are familiar with, which is a LinkU, we were able to provide information and the right resources to our clients regarding some programs that or areas of need that they had that we don't provide. CARECEN has been able to reach 11,272 people. And through this great outreach from our promoters right here, CARECEN has also hosted 17 workshops with an attendance of 15 to 40 clients in every workshop. And for these workshops, CARECEN implemented its health literacy curriculum, which consisted of 6 health topics. We talk about COVID-19, we talk about chronic illnesses, we talk about pediatric illnesses, we also talk about children immunization, mental health, HIV, and STIs. And for the 11,272 people reached, CARECEN created and distributed health messaging materials that were linguistically and culturally appropriate for our community. And of course, every one of these materials will follow the DC Health and CDC guidelines. Our health curriculum, as I mentioned before, consisted in 6 different workshops. The first workshop was about COVID-19. We talk about what is COVID-19, how to prevent it, and we also talk about the benefits of the vaccines. And on this specific workshop, we also destroy some misinformation spread in our community, like for example that the vaccine could cause autism, or that the vaccine will have a microchip that will be implemented in the immigrant community, so the government will track them down. So yeah, it was very interesting to hear all those type of rumors that were spreading in our community. We also talk about chronic illnesses, the most common types, risk factors. We also talk about prevention, causes, and also current treatments and health tips. We also talk about pediatric illnesses, understanding the different childhood illnesses, and also we talk about the difference between going to the hospital versus urgent care. And we also had a children immunizations workshop. That this specific workshop was very useful because most of the attendees for this workshop were parents, specifically some parents that recently arrived to the country, and they weren't familiar with the type of immunization requirements for their kids to go to school. So we were able to give them the information, and we were able to also provide information about places that will provide the immunizations at no cost. So that was very useful for them. We also talk about mental health, and this specific workshop we will talk about breaking cycles. We talk about self-care, depression, and we have a lot of participation from our clients, in which many of them will share their personal experiences, especially like dealing with trauma. We had a lot of newcomers that recently arrived to the country that attended to this specific workshop, and they were sharing their experience, but most importantly, they were sharing their healing process. So how they've been able to overcome those traumas. We also talk about HIV and STIs. We talk about the different types. We talk about different forms of contraceptives and the importance of sex education. We also implemented LinkU in our workshops. We would make our clients complete the needs assessment, so this way we could identify their needs and provide better help and better resources for them. We also train all our CARECEN staff, not only the health promoters, but all the CARECEN staff. We're about 30 staff members from the housing department and the legal department. They received the training on how to use and navigate through LinkU, so that way they could refer their clients in case that they needed some help that we don't offer. expanding awareness and combating misinformation. We know that misinformation spreads rapidly. And according to 2018 MIT study, fake news spreads 6 times faster than real news. So we know that that was going to be a challenge, and how would we overcome that challenge? Well, as I mentioned before, we heard a lot of rumors about some health topics in our community. So what we would do, we will create a safe environment so they could share their experiences, ask questions, and also share that misinformation. So that way we were able to give them the right data. We were able to correct those mistakes, and how we the way that we do it is by giving them the right resources and trustful like websites, for example, because most of our clients will mention that they heard some rumors on social media. So what we did is we taught them how to navigate through the CDC website, World Health Organization website, also Medline Plus is another website. So all those websites that have accurate information, and they're a trustable source of information. Also, during our workshops, we gave them some pre and post tests that were administered to measure the impact of the workshop and their understanding on health information. So this way we could measure the impact of our workshop. We saw that there was like a huge difference when we will give them the test before the workshop. We saw the results and the scores. Their scores after finishing the workshop and completing the test were way higher than the first test that was administered to them at the beginning. Yeah, and for the rest of the presentation, I'm gonna leave it to Simone. Thanks everybody for your attention.
Thank you so much, Jonathan. See, that's Jonathan right there. Jonathan is a very, very special person. He really cares. He came from El Salvador when he was a teenager, and always with a passion to help. And now he's here, helping people who have come after him. And that is what any good immigrant should do, right? Immigration is a foundational part of this country. And that is why we are here, to open the door, not to close it after we've already arrived. This workshop that Jonathan is teaching was given at Harbor Light last year, and this one was mainly directed to an audience of mostly Venezuelans who had been bussed over from Texas and Arizona. So these people obviously don't know English. They come here usually from low-income communities, and they don't have access to resources. And Venezuela has very, very strict censorship on information, even health information. Even that is politicized. So not to get too into it, but a lot of these conversations were first-time information that we give for granted. So it's very, very helpful to be a resource for our community, to continue to do that, because what we give for granted, many people don't even know. So I want to say thank you again to Jonathan. Big round of applause for him, please. Very, very important work. And would like to also congratulate La Señora Maria and Alicia for all the work they've done, for bringing people into our workshops, for expanding our program, and for touching over 12,000 people in the course of the grant. So thank you guys again. Thank you very much. So I think a very common theme that we've seen in today's presentations is meeting people where they are. I think that is a very central theme to what DC Health has tried to do, because we know that people from different backgrounds know different things. Some people know more, some people know less, and not everybody cares to the same level to research about these things. Some people might find it boring, some people might find it too complicated. Some people may already know enough so that they can survive and they don't need to check it again. And that's when different bubbles and biases start to collide. So with LinkU, we had a social needs assessment that allowed us to probe a little bit deeper to basically have the community tell us, what are you struggling with? What do you need? What is not being given to you that you desperately require to have a life here, you know? And 98% of our people identified need at least one thing that was a critical element, whether it's financial. About 90% of them listed financial needs as their primary need, followed by 71% to 76% listed medical, food, and work. About half of them listed mental health as a primary need that was underserved. So as you can see, most people have at least one need, but multiple people, hundreds of people, have more than one need that is being underserved, underprivileged, right? That means that about 9 out of 10 people that go into LinkU will find something that they need there, right? In the course of our program, we assessed about 134 individuals, and we referred 63 people to resources, whether that's job opportunities, financial assistance, medical assistance. 11 people actually sought out that help. There's this phrase that I learned in America: you can guide a horse to water, but you can't make it drink. Well, it's the same principle here. Out of the people that we referred, obviously not everybody is going to get the resources right away. That's an ideal situation, but not the truth. But at least we know that 11 people got things that they did not have before. And if we can make the difference with one person, that is enough for us, because that is what we're doing. We want to do the best we can to serve as many people as possible, okay? And that is why we will continue to have this as part of our workflow now. From the beginning of the year, you can definitely see an uptrend after April because we had more staff available to do our workshops. So we went from having 1 workshop per month to 3 workshops. And up until April, it was all Alicia. Alicia was carrying all of the DC Health curriculum by herself. And while we had another program that we were helping with the navigators in Harbor Light, our program really kicked off this year. And that's where we were able to find most of the people that we found. So we have to continue doing that. And like Jonathan said, we've trained our staff to use LinkU to refer people as well to those resources. We essentially expanded our own reach. But we also solicit feedback. We want to make sure that we are on the right track, that we're not boring people, that we're not telling them something that they already know. So after every course, not only do we administer knowledge tests to make sure that they're learning, but we also administer feedback tests and we say, hey, did you enjoy the presentation? Did you enjoy the presenter? Did you enjoy the materials provided? Did you think that they were useful, et cetera, et cetera, et cetera? 82% of the time, they gave us 5 out of 5, which is fantastic. Honestly, most of the people that were there liked it. 25% of attendance would return a second time. And it comes to this very big disclosure. People who come to our workshops are coming with a financial incentive. We're giving them a gift card of $50 to come for the first time. So it's not like we're just deliberately telling them, come on your own volition. You say, look, this is important information that we want you to learn, and here's a financial incentive that we know that could possibly help you. Second time they come, they have no financial incentive. It's on their own volition. And 25%, that's 1 in 4, would come even though there was no financial incentive. That means that at least we were doing something right. People thought, okay, maybe I can get actually something good out of this besides just the monetary value, right? 90% of people would ask us if they could refer people to our workshops. And that is because we fostered an engaging and inclusive environment in which we respected people's identities, sexualities, gender. We allowed people to be themselves, to express things that they would normally not express, like to say, hey, I heard that vaccines cause autism. What's up with that? Is that true? Should I get vaccinated? Most every immigrant that was given a workshop was already vaccinated because it was a requirement to enter the country. But many of them still felt that there was something wrong. There was something that didn't quite match because there's so much conflicting information. So we were there. We were a safe space, right? And that led us to adaptation and growth. Some of the key narratives and takeaways. Even though we are no longer in a state of emergency, misinformation surrounding vaccines is still prevalent. People need access to affordable healthcare, mental health resources, and financial assistance. People are struggling 4 years after the pandemic. And our efforts to advance health literacy have worked because we've tailored the message to the audience. We've avoided medical jargon that might seem a little bit too complicated. We've tailored the presentations to the language. And this is not because people don't understand them. It is simply because we want to make sure that what they're hearing is interesting. We're not doctors. We can't tell you a diagnosis, but we can tell you this is factual, hard data that we know is true. And if you have a problem with that, raise it, because we're happy to listen. We might learn something too, right? Debunking myths, bad information, etc., etc. That's why we're here. In summary, and again, I want to thank you guys for taking the time to listen to us. Our achievements in terms of numbers, we gave about 17 workshops since the beginning of 2023, since August of 2023, sorry. We focused on COVID. This is where it all started. Immunizations, chronic illnesses, mental health, sexually transmitted diseases, even substance abuse. And we were able to correct misinformation when it came out and reinforce that not every piece of information is a trusted or verified piece of information. So health literacy now is intertwined with media literacy itself. People need to be able to not only consume and understand information, but to also understand if this information makes sense, if it's actually truthful. It doesn't matter if somebody says it with confidence. It's like if I tell you with confidence, yes, vaccines cause autism, that is a fact. How do you know? How do you know that it's not true? You have to have a responsibility to have that doubt. And it's the reality of the world we live in. The challenge, obviously, is that is going to continue. It's a continuing challenge. People will continue to receive information from dubious sources. So we have to continue this fight. We have to continue to be a resource and continue to be open and willing to discuss these differences to make sure people understand these health informations that are critical for making good decisions. The most important lesson that we've learned is, again, the central theme of all of this is meeting people where they are. Whether they are struggling with financial information, whether they are hoping to get their kids from a war-torn country, whether they are unaware of the political climate of the United States and what their rights are. We have to meet them where they are. We have to listen to them. We have to be open about their experiences and their differences so that they can actually hear something new and say, okay, this person isn't talking to me just because they have an agenda, but because they actually have their best interests or our best interests at heart, right? And all right, I would like to leave you all with a quote from Dr. Jacinto Conbit, which is the a Venezuelan doctor that invented the vaccine for leprosy. Leprosy is a disease that we no longer have to worry about because obviously vaccines work. So the biggest lesson in life is to do good for those that are suffering. And is that not the most important thing? Then I don't know. Does anybody have any questions whatsoever? Well, thank you guys very much for taking the time to listen to us. Appreciate you all.